Welcome to Nurse's Handbook, and today I'm here with another series of multiple choice questions for the preparation of Aiims Norcet 2023. Question number 1. To measure an adult client's apical heart rate, where does the nurse place the stethoscope? Option A, fifth left intercostal space at the mid-clavicular line. Option B, fourth intercostal space at the mid-clavicular line. Option C, third intercostal space at the mid-clavicular line. And option D, second intercostal space at the mid-clavicular line. And the correct answer is option A, fifth left intercostal space at the mid-clavicular line. As you can see here in the picture, that in adults, the apical pulse is palpated at the left intercostal space at the mid-clavicular line, whereas in infants and young children, apical pulse is felt at the fourth intercostal space. Question number 2. Morose reflex disappears at which age? Option A, 6 months, option B, 4 months, option C, 3 months, and option D, 8 months. And the correct answer is option C, 3 months. So what is basically a morose reflex? It is an involuntary, sudden, protective motor response given by the baby when an abrupt disruption of body balance or a sudden stimulation is given to the baby. It disappears by 12 weeks, that is by 3 months. Moving to question number 3. When helping a stroke patient, a nurse should assist. Option A on weak side, option B on unaffected side, option C from behind, and option D from back. And the correct answer is option A on the weak side. So what is a stroke? Stroke is also known as brain damage when something like clot or embolism blocks the blood supply to a part of brain, or when a blood vessel in the brain bursts. It is called a stroke. What are the common symptoms of stroke? First is like trouble walking, trouble in speaking and understanding, paralysis or numbness of the face, arm or leg. So, a nurse must always assist the patient on a weak side to prevent the injury. Question number 4. Identify the instrument given below. Option A, episiotomy scissor. Option B, curved Mayo scissor. Option C, cord cutting scissor. And option D, Mayo dissecting scissor. And the correct answer is option C, cord cutting scissor. Cord cutting scissor is a non-ratcheted, means it doesn't have any lock system. Finger ring scissor, which is used mainly to cut the umbilical cord. The main feature of this scissor is that it is wide, flat, and have curved blades. And because of its curved curvature, we don't have to clamp the cord. Instead, the cord is held in the curvature, which makes it easy to cut. Question number 5. A client on antipsychotic therapy developed muscle rigidity, high fever, tachycardia, fluctuations in BP, diaphoresis, and rapid deterioration of mental status to stupor and coma. These signs and symptoms are indicative of option A, extrapyramidal symptoms, option B, tardive dyskinesia, option C, neuroleptic malignant syndrome, and option D, oculogyric crisis. And the correct answer is option C, neuroleptic malignant syndrome. Neuroleptic malignant syndrome is a life-threatening neurological disorder often caused by an adverse reaction to the antipsychotic drugs. The symptoms include high fever, sweating, unstable blood pressure, stupor, muscle rigidity, and autonomic dysfunctions. Question number 6. Clinical manifestation of fetal alcohol syndrome includes option A, hepatomegaly, hypotonia, and microphthalmia. Option B, anencephaly, hydrocephalus, and microglossia. Option C, hyperbilirubinemia, jaundice, and failure to thrive. Option D, microcephaly, short philtrum, prenatal growth retardation. And the correct answer is option D, microcephaly, short philtrum, and prenatal growth retardation. What is fetal alcohol syndrome? It is a condition that develops in a fetus when a pregnant lady consumes alcohol during her pregnancy. So, what does the alcohol do to the developing fetus? It interferes with the normal development of the fetus, particularly it affects the brain and the central nervous system. So it can occur in any of the following ways. Like, first, alcohol may kill cells in different parts of the fetus, causing an abnormal physical development in the baby. Second is, alcohol may interfere with the nerve cell development. Third possibility is, alcohol constricts the blood vessel of the mother, because of which slow blood flows to the placenta, causing a shortage of oxygen and nutrients to the fetus. Lastly, alcohol produces toxic byproducts which gets concentrated in the baby's brain cells and causes damage. Question number 7. The doctrine of informed consent deals with option A, notification of diseases, option B, patient confidentiality, option C, full disclosure of all relevant facts to the patient, and option D, informing higher authorities about the patient's condition. And the correct answer is option C, full disclosure of all relevant facts to the patient. So what is an informed consent? It is a process in which a healthcare provider explains the patient or the significant others about the risk, benefits, and alternatives of a given procedure or intervention. Informed consent is mainly taken when an invasive procedure has to be done. Secondly, when the patient is a minor, consent is given by the parents or by the guardians. Question number 8. Which of the following is a model based on a person's relationship to stress, their response to it, and naturally dynamic reconstitution factors? Option A, universality theory. Option B, Newman's system model. Option C, Roy's adaptation model. And option D, Parse's human becoming theory. And the correct answer is option B, Newman's system model. Newman's system model was developed by Betty Newman in the year 1972. This model was based on stress and the client's reaction to the stressors. So according to Betty Newman's model, it was considered that any internal or external factor that affects the patient is known as a stressor. Question number 9. How would a nurse record smoking history of a patient who has smoked 2.5 packs of cigarettes per day for 10 years? Option A, patient has a 25 pack year smoking history. Option B, patient has smoked cigarettes for 10 years. Option C, patient has 12.5 pack year smoking history. And option D, patient smokes 2.5 packs of cigarettes per day. And the correct answer is option A, patient has a 25 pack year smoking history. So, whenever we have to record the smoking history, we mention it in pack years. So, let us see the formula for calculating the pack year. Pack year is equal to number of packs smoked per day into number of years the person has smoked. So we will be putting the values in the formula. So that is 2.5 cigarettes per day into 10. It will give the answer as 25. Question number 10. Fetus develops its own blood supply from dash week. Option A, 10th to 12th week. Option B, 12th to 14th week. Option C, 12th to 16th week. And option D, 12th to 20th week. And the correct answer is option D, 12th to 20th week. Question number 11. What is the use of this equipment or object in care of infant? Option A, to treat hypothermia in infants. Option B, to maintain humidity. Option C, to prevent insensible loss of water. And option D, to provide oxygen. And the correct answer is option D, to provide oxygen. This equipment is known as the oxygen hood. It is a plastic dome or box with warmed and humidified oxygen inside. It is specially used for those babies who can breathe on their own but still need extra oxygen. Question number 12. A person ingested 50 tablets of paracetamol and arrived in emergency department. Which of the following is the primary nursing action for this patient? Option A. Administer N-acetylcysteine. Option B. Check serum PCM levels. Option C. Administer activated charcoal. And option D. IV fluids. And the correct answer is option A. Administer N-acetylcysteine, as N-acetylcysteine is the antidote for paracetamol poisoning. Question number 13. Which of the following techniques is the appropriate ear drop installation in a 2-year-old child? Option A. Pull pinna inward and downward. Option B. Pull pinna inward and upward. Option C. Pull pinna backward and downward. Option D. Pull pinna backward and upward. And the correct answer is option C. Pull pinna backward and downward. Pulling the pinna backward and downward will straighten the ear canal. Question number 14. Which of the following is the earliest signs of pressure ulcer? Option A. Cyanosis. Option B. Skin discoloration. Option C. Coolness. And option D. Edema. And the correct answer is option B. Skin discoloration. So, pressure ulcers are also known as bed sores or the decubitus ulcers. So what are pressure ulcers? They are the localized area of tissue necrosis which has developed when the soft tissue is compressed between a bony prominence and an external surface for a prolonged period. We have some warning signs of the bed sores, that is, the part of skin becomes discolored. People with pale skin, you will see red patches, and people with dark skin, you will see blue or purple patches. And if there are any signs like swelling, pus-like draining, and any area of skin that feels cooler or warmer to touch, and if there is tenderness, then we should be aware of it and take the necessary steps accordingly. Question number 15. A chronic alcoholic patient blames his family environment for his alcoholism. Which defense mechanism he is using? Option A. Avoidance. Option B. Denial. Option C. Rationalization. And option D. Sublimation. And the correct answer is option C. Rationalization. So what is a defense mechanism? They are the unconscious psychological responses given by a human being in order to protect himself or herself from the feelings of anxiety, threats to self-esteem, and the things that one doesn't want to think about it. So here, rationalization is also a type of defense mechanism. In this, a person provides a good reason for the use of drug or alcohol or any other bad behavior instead of the real and true reason. And why this rationalization is being used? It is used by the people to defend oneself against the feelings of guilt and also to protect oneself against criticism and to maintain the self-respect. Thank you for watching. For more such videos, do like, share and subscribe to our channel Nurses Handbook.